Well, for me it's extremely important because this is, I've been involved with this course since the second edition, and I think that this compound that we are going to be talking about for the 2 days is really a breakthrough in the treatment of the anemia and iron deficiency. And it will give the opportunity to a better management of patients in many medical and surgical areas. And it's something that up to today we only can do it with IV iron, but now with this compound we have a new opportunity to a more easy treatment, a more comfortable treatment for the patient. So for me it's quite important to share all the knowledge that have been developed around this new molecule with all the colleagues we are going to meet here. I think we will be something like 300 or more.
I come here just for my own interest in my research, but also as president of the International Society for the Study of Iron in Health and Disease, BioIron. And so for me it is, from a scientific, medical, clinical point of view, extremely important to learn more and to get acquainted with all the technologies available for iron supplementation in a world of increasing demand for compatible sources of iron, which are also user-friendly. And with this increasing growth in interest, I think it's very important the new products which have been brought by the cyclosomal iron, by Pharmanutra, and therefore I am extremely interested in learning more about its unique properties, particularly in basic research, which is sort of setting the ground for what we expect to be more expanding use in the clinical arena.
I'm here to represent and talk about something called patient blood management. We have been always looking at transfusion, and transfusion is a therapy. And in medicine, we first have to identify what is the disease and then the treatment. So we concentrate in patient blood management on the patient and the disease. And the reason I'm here is because of anemia. Anemia is a disease, it's actually an epidemic. And it is a huge epidemic, and it affects children, women, and of course men. Now the big question is treatment. And today I'm going to be speaking about the pediatric population that goes to surgery. And we have always thought about treating anemia in this population because of the short amount of time with intravenous iron. Because the preparation of oral iron is old. Now I think that in this Congress today, this is very important to let the medical community know that we have now oral iron, different preparations, liposomal being one, where there's no issue with absorption. Time is no longer a limitation, and it just opens a huge opportunity to educate the medical community and for us to have much wider opportunities to treat patients with anemia who are going to surgery. So both intravenous as well as oral now are probably an opportunity that we need to harness into the daily practice.